Welcome to Health Matters, brought to you by the Office of Correctional Medicine at Southern Illinois University School of Medicine. This video is for informational and educational purposes only. It is not intended as medical advice and should not replace consultation with a qualified healthcare professional. Always seek the guidance of your doctor or other licensed medical provider regarding any questions you may have about your health or medical condition. In this video, I'm going to go over what a SOAP note is, how to write one, and go over some tips. A SOAP note is a structured method of documentation used by healthcare professionals to capture clinical details of patient encounters. SOAP stands for Subjective, Objective, Assessment, and Plan. These notes provide a clear and concise overview of the patient's medical condition, diagnoses, treatments, and progress over time. A SOAP note can be used by nurses, doctors, and other healthcare providers to share patient information to improve the quality of patient care. Detailed SOAP notes are necessary for meeting regulatory and legal standards, and they serve as proof of all care provided to patients in cases of audits and legal action. First, we have S, Subjective. This section captures the patient's reported experiences, symptoms, and concerns. This includes information given by the patient related to their past medical surgical history and their family history. There are several parts that go to this section to make sure the information documented is full and complete. The first component is the chief complaint, or CC. This is the primary reason the patient is seeking medical care. It should be stated verbatim in the patient's own words. An example of this would be, "I have a headache." Next is the history of present complaint or illness, or HPI. This is a detailed account of the patient's current condition. An acronym to remember for organizing information is OLDCARTS. Onset. When did the CC start? Location. Where is the CC located? Duration. How long has the CC lasted? Characteristics. What is the nature of the CC? Aggravating and alleviating factors. What makes the CC worse or better? Radiation. Does the CC spread to other areas? Timing. Is the CC worse or better at certain times of the day? Severity. On a scale of 1 to 10, how severe is the CC? An example of this component would be, 45-year-old male presents with a headache. He reports a throbbing headache that started 3 days ago in frontal area. Patient reports headache worsens with activity and certain head movements and is alleviated when lying down. Headache is usually worse first thing in the morning. Rates current pain 5 out of 10. Next on the list is past medical history, or PMH. This is any pertinent, current, or past medical conditions, surgeries, hospitalizations, ongoing treatments, social history, and pertinent family history. An example of a recorded PMH is, patient reports history of sinus infections that occur 1 to 2 times per year. He usually experiences headaches in frontal and orbital areas with sinus infections. No known drug allergies. Currently takes fexofenadine hydrochloride 180 milligrams by mouth daily for seasonal and environmental allergies. Lastly, we will record our review of symptoms, or ROS. This is a systematic review based on a list of questions that can help to uncover other potential symptoms that the patient may be experiencing. An example would be, general, decrease in appetite and fatigue, head, ears, eyes, nose, and throat, frontal headache, pressure around eyes and cheeks, and nasal congestion. Denies chills, cough, runny nose, visual changes, dizziness, shortness of breath, nausea, and vomiting. Our next step is O, objective. This section of the note is for documenting observable, factual, and measurable data. This information can be gathered by physical examination, test results, and observing the patient's general appearance, mood, mental status, and behavior. This could be done through vital signs, a physical examination, and labs and other diagnostics. An example of what should be recorded is, well-nourished white adult male. Patient is alert and oriented ×4 with normal speech. No motor deficits noted. Facial grimacing noted when patient moves head side to side and when he bends down. Vital signs. Blood pressure is 135/80, heart rate is 78, respirations is 14, temperature 99.6 degrees Fahrenheit. Perla, no nasal drainage, postnasal drainage noted, tenderness of bilateral cheeks, orbital and frontal areas with palpation, lungs clear, respirations regular and unlabored, heart rate regular, no murmurs. A is next, and it stands for assessment. This section provides a summary of the patient's clinical condition based on the subjective and objective findings. This is where you will interpret the findings, make a primary nursing diagnosis, and list any other differential diagnoses. For the diagnosis, you should provide the primary nursing diagnosis or the most likely condition that is affecting the patient based on the information available. An example of this would be onset of frontal headache and tenderness and pressure of frontal, sphenoid, ethmoid, and maxillary sinuses that started 3 days ago. The presence of sinus pain and pressure, low-grade fever, nasal congestion, and postnasal drainage suggest acute sinusitis. Our final letter P stands for plan. This last section outlines the steps in management, treatment, further testing, patient education, and referrals to address the diagnosis that was formed from the assessment. The first component of this section is treatment. This is where you will specify any medication, procedures, or interventions that were prescribed. An example being ibuprofen 400 milligrams by mouth every 6 hours as needed for pain and fever relief, per standing orders for treatment of pain and fever. Hydration and rest. Next is follow-up, referrals, and consults. Here you should indicate when the patient needs to return for follow-up or if any additional monitoring is needed. This could look like patient will be scheduled to see MD in sick clinic tomorrow for evaluation of signs and symptoms of acute sinusitis. The last component is patient education. For this last piece, you should provide the patient with instructions on how to manage current symptoms, discuss lifestyle modifications, or any other precautions that should be taken. An example of this section would be discuss rest, increase in fluid intake, sleep with head elevated, warm compresses to sinus areas as needed to decrease pain, and avoid dairy products until symptoms resolve and patient verbalized understanding. Now that you know what a SOAP note is and what goes into it, let's discuss some tips. First of all, it is important to be clear, concise, and thorough. This will ensure that anyone reading the note in the future can pick up where you left off with a clear view of what happened and your thought process. Next, always be sure to follow the format closely. This will make it harder for you to miss key information that should have been shared. Lastly, if there are multiple issues, you should address the most urgent concerns first. Thanks for watching this guide on how to write a nursing SOAP note. Remember, effective documentation isn't just about checking boxes. It's a vital part of providing safe, high-quality patient care. Using this SOAP note format helps you stay organized, communicate clearly with your team, and meet professional standards. The Office of Correctional Medicine at Southern Illinois University School of Medicine invite you to look for more educational content in our Health Matters series.